As a parent of a child with a complex heart defect, you have already developed a large amount of knowledge and skill to care for your child. However, there are some things about the Fontan operation that are different, and you may have some worries about the Fontan. The purpose of this and other videos is to help prepare you for your upcoming journey. Flow of blood through the heart changes once the Fontan is done. As a result, blood clots can form. Of course, this is a scary thing for you as a parent to think about. Please be assured that it is our job to worry about this. This is why we have a Kid Clot team. The Kid Clot team has specialized doctors and nurses that are devoted to your child staying clot-free. To prevent a blood clot, your child will require treatment with a blood thinner. A blood thinner decreases the risk of a blood clot. There are a number of blood thinners that may be used. The Kid Clot team will choose the best medication for your child considering his or her condition after the Fontan. You can expect that within 1 to 3 days after your child's surgery, he or she will be started on a blood thinner. The blood thinners used may be familiar to you. Right after surgery, enoxaparin, which is given by injection under the skin twice a day, may be started. The needle used for the injection is short and thin. Heparin also may be used through a needle in the vein. Heparin or enoxaparin are only used for a short time until it is possible to switch to a medication taken by mouth. Once your child is eating and the pacing wires have been removed, he or she will be switched to warfarin, sometimes called Coumadin. Warfarin and Coumadin are two names for the same medication. You may have family members who have taken Coumadin and have heard stories about its use. The Kid Clot team will work closely to help you understand warfarin better. Warfarin takes days to weeks to reach stable effect. Doing a blood test called an INR keeps your child as safe as possible while on warfarin. The INR tells us if his or her blood is thin enough, but not too thin. At first, the INR is needed daily for a few days, and then weekly. The INR may be done less often once the results are consistently good. At the Stollery Children's Hospital, in most cases, we will be able to loan you a handheld INR meter that is used to test the INR at home. We will teach you to do a finger poke, to drop a small drop of blood onto a test strip that has been placed in the INR meter. You and your child will participate in learning activities to help you better understand warfarin and how to do a finger poke to check the INR at home. When you're at home, you will do an INR on the meter and call the Kid Clot team with the result. The warfarin dose will be changed if needed. Using a meter makes INR testing easy and warfarin safer and more effective to use. Most importantly, families tell us that it improves their quality of life. How long your child will be on warfarin will depend on your child's condition. There will be no changes in the foods your child eats because of the warfarin. The INR meter is on loan to you, and you will be responsible for it. The length of time you have the meter will be 1 year, or longer if the Kid Clot team has a good supply of meters on hand, or until your child stops warfarin therapy if that is sooner than 1 year. The INR meter must be returned in good condition so that another child can also have the benefits of using an INR meter. If we've run out of meters for loan, you may choose to purchase one. The cost is about $450. New blood thinning agents for children may become available in the near future. It is possible that your child may be eligible for a study of one of the new blood thinning agents. If so, you will be contacted by our team about your child's possible participation. In summary, thinning of the blood with medication is necessary for at least a few months after the Fontan, and sometimes for years, depending on your child's specific situation. The Kid Clot team will participate in your child's care to help you learn about blood thinning medications and how to monitor and adjust these medications. This video was developed by the Fontan Education Study Team at the Stollery Children's Hospital. Thank you for your attention.